So if you know anyone who is interested in participating, but they weren't able to make it, they can still see the information. So, let anyone know if you have someone you're like, oh, they'd be perfect for this, pass that along. Essentially, the plan today is to review just a general overview of the RFA, and then we were going to open it up for questions at the end. However, as we're going along, please feel free to type any questions or comments you might have in the chat as they come up, and then we'll just address them in that Q&A period. So with that, let's get started. Next slide, please. There we go. Thank you. All right, so before we get into the RFA, I wanted to introduce us. So we are the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based healthcare. So since 1995, the School-Based Health Alliance, a 501c3 nonprofit corporation, has supported and advocated for high-quality healthcare in schools for the nation's most vulnerable children. Working at the intersection of healthcare and education, the School-Based Health Alliance is a recognized leader in the field and a source of information on best practices for philanthropic, federal, state, and local partners and policymakers. Next slide, please. So what's the why? Why do we do this? What do we believe? We believe that all children and adolescents deserve to thrive. Too many struggle because they lack equitable access to healthcare services. School-based healthcare is the solution at bringing healthcare to where students typically spend the majority of their time, in school. When health and education come together, great things can happen. Attendance improves, conditions like asthma or diabetes can be better managed, behavioral health issues can get quick and expert attention, and we all know that healthy students make for better learners. Next slide, please. So for this project, we are proud to partner with the National Council for Mental Wellbeing and their Center of Excellence for Integrated Health Solutions on a new learning collaborative targeting community mental health and substance use treatment organizations, including certified community behavioral health clinics, CCBHCs, to support their partnerships and/or integration with schools and SBHCs. Next slide. So I've already sort of introduced myself, but just to kind of bring it back, I'm Donnie Grieco, a program associate here at the School-Based Health Alliance. And now I'd like to hand it over to my colleague, Katie Stinchfield, to introduce herself. Katie, please take it away.
Thanks, Donnie, and welcome again, everyone, to our RFA info session today. We're so thrilled to have everyone join us and learn more about this opportunity. So I'm just going to go through the different sections of the RFA. If you click on the application link, you'll see all of this within the RFA, the online link and form. The purpose and scope, big picture, we're hoping to select between 10 to 15 eligible community mental health organizations to participate in a 6-month learning collaborative to support partnerships and/or integration with schools and/or SBHCs. So community behavioral health, mental health organizations working in schools or partnering with school-based health centers for more integrated care. And we're hoping that you'll be open to fostering collaboration, that we'll develop a cohort of individuals and some peer networking, and that you'll establish good relationships for expert TA from SBHA and other experts in the field. Benefits of participation include that networking and peer-to-peer learning with peers and experts, virtual learning sessions and coaching opportunities every other week, and planning and technical support from SBHA, National Council for Mental Wellbeing, and again, other national and regional experts in the field. Again, more benefits, structured assessment and evaluation tools to determine needs and assets accurately as you work to partner with schools, resources to develop and improve partnerships with schools, opportunities for peer feedback and collaborative problem solving as a cohort. We're able to offer CEUs, so continuing education units for each session attended, and then we'll create tools for our cohort, including some virtual convening and sharing platforms, Zoom, Basecamp, others as needed. So who should apply? It's pretty open. Community mental health and substance use treatment orgs, CCBHCs, just having a strong interest in initiating or improving services in the school setting. We're looking for dedication to improving youth mental health, motivation to engage and foster peer learning relationships, and the ability to participate in all the meetings and required activities, of course. So here's more detailed list of requirements. Again, community mental health or substance use treatment org. You obviously need to submit a complete application. You would need to identify a school-based services staff champion. So that would be someone who would be from the community mental health organization, but who would be taking the lead on this partnership with the school and participating in all of our learning sessions, in addition to any other applicable team members. And then they would be taking the lead with developing those partnerships with the school. We need a signed letter of agreement with SBHA for the duration of the project. And we'd need to have an established multidisciplinary team that will participate in the series. Again, that champion, and then whoever else makes sense on your team. I think it varies. So we would just want to collect that information in the application, who you would propose being on your team. And then there's some implementation planning and prep work, including a readiness assessment and pre-survey, if selected. In addition, we're looking for full commitment to participation in all of the activities, open mind, willingness to uphold safe space practices established by faculty and facilitators during sessions. We'd want to have each selected group present to the cohort on progress and successes and challenges at least once. So we'll have a format for doing that. Communicate with other participants and experts between learning sessions. So again, in some of those online platforms like Basecamp, we'll be looking for continued communication between the learning sessions. Weekly completion of online workbooks as assigned. We'll have some different tasks to work on in between sessions. And then again, utilizing Basecamp and Zoom to continue discussions in between sessions. So these are all of the project timelines. The key dates to know now are that applications are due on January 31st, and we are hoping to do a very rapid selection process and notify sites by February 2nd so that we have time to get all of our learning sessions in before the end of the summer. And the broad pieces of the application include the contact sheet with duplicates if applicable, and we'll talk about that in a second. Signed assurance page, and it is an online form to fill out. So the application is an online form, and within that online form, you would be doing online signatures. And so you want to make sure that you have your CEO or director and your project lead available at the time that you're submitting the application so that you can get those online signatures. And then the final piece is a statement of capacity and readiness. More on that shortly. So here's an overview of the contact information we're looking for. Pretty simple, basic organization information. And Donnie will put the RFA survey link in the chat if you want to start looking through this to see all these pieces in the form. And then we've included a section for school information. If you are already partnered with a school or you've already started talking with a school, you could include their information here. If you have multiple schools, you can duplicate this section and include information for all schools. But this is not required. We know that some sites are still sort of exploring the opportunity to work with schools. So no worries if you don't have it, but please include it if you do. And then again, there's a section for these assurances where we'll need the CEO, director, president signature, and then the school-based services staff champion, the project lead signatures, and you'll want to get those as you're completing the application. And then these are the kind of bullet points to cover in the statement of capacity and readiness. So interest and motivation to participate, how your organization is prepared to execute the project. And we're not looking for you to be perfectly ready to partner with the school right now. We're looking for willingness and capacity. We understand that a whole part of this process is learning how to partner in a school and work with a school. So we're not looking for you to have that established already, but we're looking for kind of interest in how your organization is poised to pursue that. And then we'd like to know about your current services, any services that might have value in the school setting, including services you could refer out of the school for, but just, anything that you could bring into the school or that would connect to a network of services that might support school-aged youth. Any past or current collaborative efforts with schools, and your sense of your capacity to partner successfully. We want a maximum of 1,000 words. A bulleted list is acceptable. No novels, please. We want to keep it short and simple. And I will pass it back to Donnie for some Q&A.
All right. Well, thank you
Thanks,
very much,
everyone.
Katie. At this point, we are ready to open up any questions you might have. Please feel free to type in the chat and we can go from there. All right. So Nancy asks, can a network of SBHCs that has integrated physical and mental health services apply to strengthen how it could potentially expand their mental health and behavioral health capacity? So Katie, do you want to take that one? You want me to go?
Yeah, so I'm thinking, so you already have established SBHCs with physical and mental health. Nancy, maybe tell me more about what you would be looking to expand or strengthen. It sounds as though you've already got a lot of great pieces in place. As you can see, it's not a hard yes or no. I'm not sure if participants can talk. Nancy, I apologize. I think that you just have to type. I'm so sorry. Essentially what I would say, I mean, if you're able to type, great. Essentially what I would say is we are open to, no worries, Nancy. We're open to a variety of applicant types. I think if you're already working in schools, I don't know that this particular opportunity is the best fit for you, and that we really want to support folks to work in schools. But I think if you want to reach out, check in with me maybe with some more detail and or depending on what you can type right now, and then maybe see if there's a place in the cohort that you would fit. We're kind of open to considering a variety of options. And while Nancy's typing, yeah, so Roxy, I'm going to answer some other questions, Nancy, but I'm waiting for your question if you want to type it now, or feel free to follow up with us via email later. I know Donnie's going to share our contact info.
Yes.
Roxana, this does include high schools. This would be anybody in a K-12 education setting. If your public schools provide pre-K, we'd be willing to talk about that too. So the idea is just to get those mental health services into schools, and that might be very early ages. It might be, it would be all the way through high school. Typically not past high school. We're not looking for colleges or universities to apply per se for this opportunity, but all of those other ages. Any other questions? I don't see any in the chat yet. Will you send us the link? So Donnie can pop that link in the chat again.
Yep.
And then funding for services provided to schools. Great question, Lisa. So yes, and it's complicated. So part of what we'll kind of explore in this cohort is how to fund and create sustainable partnerships with schools. So there's a variety of things. There's community behavioral health programs that are billing for individual and group sessions when they work in schools. There's schools that offer contracts to community mental health organizations or to FQHCs and others to provide mental health services, primary care services, partner to build out a full school-based health center with integrated care. So there's a whole variety. Different school districts will dedicate different funding. Sometimes there's federal funding that comes down that gets used that way. So lots of different opportunities. Athena, I see, are there areas of the country that are preferred over others? I know we're looking for a good geographical spread. I know we're interested in representing kind of all aspects, urban, rural, different diverse areas. So I would encourage anybody from around the country, all areas to apply. Do services have to be clinical or can they be preventative education? So Celia, we're looking at the full spectrum of mental health care, which to me includes preventative services, but I'd love to kind of see more about how, learn more about your organization and what you were, specifically looking at doing there. And again, feel free to send a follow-up email if you want to get more advice. But I think that quite often in schools, quite often when we're working with younger people, that a lot of the work we are doing is preventative, and there are areas where they've made that, billing for that. There are ways to make it much more sustainable, and we would get into that with this cohort too. Okay, so let me see here. I saw Nina said we're an FQ that provides, so federally qualified health center that provides primary care and behavioral health. Our mobile unit goes to schools to provide behavioral health. Are we eligible to apply? So Nina, this would be kind of where we're looking at that gray area of what would you be looking to achieve in this cohort? So if you're already doing services, are you looking to expand services? Are you looking to strengthen the quality of the services you provide? So we'd want to learn more about what you're looking to achieve in participating. So Amy says our agency CCBHO provides, or is that CCBHC maybe? Provides school-based therapy to students in 60 schools within 12 districts. Could this be used to expand services with more therapists in our program? Our program has been up and running for almost 20 years. So Amy, kind of similar to what I was saying to Nina, that we would want to learn more about how what your goals would be in terms of expansion and quality improvement in participating. I think, we're open to considering sites that are already up and running, but we also want to support those sites that are just developing too. And Nancy agrees with current attendees. Have services need more and maybe way to do things differently to allow access to more. Yeah, because I think that's a viable sort of question or situation, right? That you're already there, and no worries, Nancy, we got you. If we can improve quality, if we can make things more sustainable, if we can improve integration and get more students in the door and more trust for the services, that sort of thing, I think that those would be good things to look at too. It seems like we have a lot of folks on this call that are already providing services. Is there anybody that has a question that hasn't started providing services and is interested to learn more? Be very interested to see who all we have considering the opportunity. Keeping an eye on the chat. Don't see any yet. Kimberly's new and very interested. Awesome, Kimberly. Yeah, I think different components and learning sessions. Yeah, so glad to hear we've got a diverse mix of folks that are maybe looking at quality improvement versus new programs. So Athena asked about the different components of learning sessions. So what we are still sort of developing our different topics, but through our work with the National Council over the last couple of years, we've definitely kind of honed in and via experts in the field, honed in on some core topic areas, forming partnerships, sustainability, workforce development, those things, those sorts of things. So still developing, but should have a pretty solid curriculum shortly. I know we want to include some justice, equity, diversity, inclusion sessions, social determinants of health session, in addition to kind of the core ways of building out school-based health services and mental health services. So Betsy said, provide some services and very interested in expanding. And then Lisa said, do we need to already be at an SBHC? So not at all. I think that's something that can be a bit confusing here too. We want, we are targeting community mental health organizations because that's, broadly the audience of the National Council, and that's the project that we've been working on with them over the years, is to promote that integration in schools. But we also are really interested in integrated care. Obviously, we are the School-Based Health Alliance, so our kind of gold standard model is a school-based health center where you get not only the school-based mental health services, but also primary care services, often oral health, dental services, vision. So not required at all, but definitely here to support everyone in moving towards that, really comprehensive integrated care model. But we understand that it takes time to build that out. And sometimes the best way to get your foot in the door is providing mental health services in the school, and then building those partnerships and eventually working towards more expanded care options. I see I'm an independent clinical therapist looking to develop a community mental health agency or group. Interesting. Okay, yeah. I would be interested to see what an application like that looks like in terms of, being able to contract capacity to work with a school, or maybe looking for some partnership options. So let us know if we can help with that. Relatively new, Nina says, about 1 year, still trying to figure out billing. The schools in which we provide services are not clear as to whether they should bill for our services or if they can allow us to bill. Okay, interesting. Yeah, sometimes there's some overlap with Medicaid billing in schools. So that's a great question that we can work through in this cohort. If we need any technical support during the application, can we reach out to you or Donnie? We have nearly 13 days to the 31st. Yes, it's a quick timeline, and you can absolutely reach out to us. Donnie is the mastermind of the survey. Did you want to add anything or?
No, I mean, that's real, like anything, even if you have, we always say there are no stupid questions, really. Ask anything you feel, don't hesitate to reach out to us. And, I will provide our contact information. We're happy to help in any way. And if Katie and I don't know the answer, we'll find someone who does. So we get it, that it is kind of a tight deadline, but we are here to help. We are your support, and we will do whatever we can to make it an easy process for you.
Fantastic. Yes, Donnie is incredibly helpful, and I also do my best, but Donnie knows everything about that form. He built it himself. So if you have application questions, Donnie's your guy. General questions you can shoot to me, but we are very happy to help. Very flexible in considering the different ways this can work. How many staff members would need to be active in the learning sessions, and how many schools would we focus on? So again, that's sort of up to you. We would be interested in hearing your capacity. I know every organization is different, so we didn't want to say you have to have this or this. We didn't want to set a number of schools. I think many times people start with one, and that's fine. I think building a strong foundation is important, and so if you start with one school, that would be great. I think it's hard if your project lead or your champion is the only one working on this. It may be hard to get the job done. It's a lot of pieces and a lot of partnership, and you definitely want to have the support of the community mental health organization as well as the school. And so we're open to considering only that person attending the calls, as long as they have really strong support behind them from their employer at the community behavioral health organization and their partnership as they build it with the school. And I see Celia said, Healthy Minds Alliance is an innovative AmeriCorps program that builds capacity to address local mental health needs. Our partners include a handful of school districts across the nation. We know there is a great need in the school setting and would like to expand. AmeriCorps member focus on preventive mental health awareness. Okay. Interesting. I'm gonna look up more about Healthy Minds Alliance, Celia. Yeah, this is interesting. We've got contact info. I'm just scanning through the chat. Partnerships. So there's already a community-based mental health program that goes into families' homes. I'm looking at Aaron's comment. We're interested in how to get involved with providing services at the schools, but do not have those relationships currently. How would this group work if you are not seeing individuals in the schools yet? Aaron, we're totally open to that. It sounds like you have a good foundation for providing services sort of outside the office, in homes, schools being obviously a different entity, but that would be some of what we would explore and help you learn. And I think if we do end up with a cohort of folks who are already doing that and looking at some quality improvement versus folks who haven't started working in schools yet, also our faculty and guest speakers will have a range of experience working in schools. So I think we could support you in working through that. A lot of what we want to do is sort of these readiness assessments where we're looking at where are you, because we're not going to say you have to be a certain place, so really assessing like, where are you? What does your program already do? And, based on our experience, what then do we need to work on and help you action plan for to be able to be successful in moving to the next step for you, which might look different for everyone in the cohort, for every organization, because everyone will start in a different place, but kind of support everyone as they move along towards that goal of integrating and providing services in the school. We will be sharing a copy of the recording Following the session, I think that we'll be able to send it out to all the attendees of this session. Andrea, our guru, is in the background working on all of that, but I think we can send it out to this list that attended today, and then we'll also post it on social media and try to send it out in our digest with the application link until we close the applications. Awesome. Andrea said everyone will get a recording. Perfect. Any other questions we can answer live? I don't see any in the chat, so I'm going to let Donnie do a brief plug for our conference. And then please keep entering your questions. We'll answer them if there are any more.
All right. So I just wanted to say we have missed seeing the school-based health center champions from across the nation during the pandemic. And we're actually really excited because we have an in-person convention for 2023. So please consider joining us. It's from June 26th to 29th. The registration begins March 1st. We would love to have you share your work through a presentation or post, or have the opportunity to network with you in person in 2023. I hear really good things. I'm going to be honest, I actually haven't attended an in-person conference yet. This will be my first one, so I'm pretty pumped about it. And more information to come soon, but we just wanted to start kind of getting that out there. So, save those dates, put that in the back of your mind. If anyone has any interest, you can feel free to reach out to us about that as well. We can answer questions as we can, but honestly, that's kind of coming later down the pike, and we're really excited. So thanks, everyone.
Awesome. Thanks, Donnie. Yes, and I have been to the in-person convention before, and it is a fabulous way to connect with other people in the field. So if you're interested at all in kind of the school-based healthcare, school-based health center field, it is a great way to connect with others and build a lot of great energy for serving students in schools. I don't see any further. It'll be in Washington, D.C. Sorry, Lori, are you guys able to see my screen? I hope I'm not blocking it at all. Washington, D.C., June 26th through the 29th at American University. Sorry if you were looking for the specifics. Thanks, Betsy. All right, so I'll leave our contact info up, and if you guys have any further questions, I'll keep the chat open a bit longer, but again, email us with any questions or thoughts. Feel free to turn in an application. We'll give it a good review. And we look forward to seeing everyone's applications shortly.
And even feel free to get started on the application, plug in what you can. And if you run into a problem, that's where you can reach out to us and say, hey, I have a question about this part. Any specific questions, we are happy to answer them. So, get started, get what you can in there, and we can go from there. We encourage your participation.
Awesome. And if you have any glitches filling out the application online, Donnie can also help with that. He's amazing at it. So,
I don't know about amazing, but I will definitely do what I can to help. So.
There is a link for the application, Donnie. You mind popping it in the chat again?
Sure.
So we really appreciate you guys joining us and learning more about the opportunity. Definitely follow the link to apply, and we will keep sending this out via our digest and our social media accounts too. So we look forward to hearing from everybody. I'll give the chat another second. Oh, I see another one popped up. We're newly funded SPHC, have been working in schools, helping with physical health and vaccines. We've not started working in school yet as the area is getting built. Apply this early on. So you've already, so Diana, have you been providing mental health services in schools or only physical health? I'm curious to know. Either way, I think it sounds like you're kind of in this space, only physical health. So you're looking to integrate mental health. Yeah, I think this would be a great opportunity for you. That's what we're really trying to drive here, is getting those mental health services in schools. So if you already have the physical health piece, we'd love to help you build out the mental health piece, or that integrated care piece with physical health. And again, we're looking at, if you're ready to partner with a school, awesome. If you're just in that planning phase, I think this is a great time to be thinking through some of these different aspects. I know certainly in my experience, it's great to do as much planning and sort of laying a foundation before you dive into providing services. I think it's it's harder to back the cart up once you've gone down the road with it. And so, yeah, I think if you're in the early stages, that's a great time to be thinking about this. Any other questions? I'll give it a couple more minutes, see if anyone else has any.
And if you don't have one right now, but you have like right after we get off and you're like, oh, I forgot to ask this, you can just shoot us an email. We will answer them. We definitely will. So we don't want to pressure anyone, but just want to give you this time, to answer them live as, needed.
I don't see any more popping up. Oh, so Kimberly said the question about mental health and primary care, I only provide mental health. Yeah, so again, we're kind of working across that whole spectrum of getting services to students. So we know that meeting students where they are at school is a great way to support all of their needs and keep them in school and help them be successful academically in life. So then when you backtrack to how to do that, people start in different ways. So it sounds like there are people on the chat that are already running fully integrated school-based health centers, and there are people providing our previous question around, they're providing physical health services but not mental health, so they want to build in the mental health. Many people would start with just mental health. So I think it can look a variety of different ways. What we'll really be talking about on this call is obviously the focus will be integrating mental health services in schools, but again, that might be for the first time ever, mental health only. It might be improving upon mental health services that are already being provided or expanding those services. It might be building out integrated mental health and physical health services, maybe other services, supporting your SBHC and integrating. So what we really want to achieve is quality mental health services in schools. So no worries if you don't do primary care yet. We'll work on that down the line. It's always something we promote because we feel like being able to meet all student needs it is kind of the gold standard, but we have to start somewhere. So no worries if you only do one piece of it now. We can still absolutely work with that. So that's a great question. So I see Hannah put in, will there be education and resources shared on funding sustainability for CCBHCs whose funding is sunsetting soon? So that's where, we have this fabulous partnership with the National Council for Mental Wellbeing, who have their CCBHC Success Center. And I think we would defer to them on how the funding would work, but I think that they have a lot of resources for supporting CCBHCs through kind of all aspects of the process. So if that was kind of a significant question for the group, we could have a presenter come on, and if not, we could connect you to someone at National Council to work with you with your specific situation. And I see, can after school programs that offer mental health workshops for their students apply for this funding? After school programs like the Boys and Girls Club programs. I'm not sure. So what we're really looking at are community mental health organizations. So usually like a county mental health or a federally qualified health center, someone, CCBHC, as we've talked about, who's able to provide mental health services in the schools with licensed clinicians and bill for those services, because that's a piece of the sustainability part. So it would sort of depend on how, on what those programs look like. I'm guessing that this would not be a fit, that the Boys and Girls Club would not be a fit. But thank you for checking. I think it's certainly a program that we want to partner with and support as much as possible. But I don't think this particular opportunity would be a fit. Great questions. You guys are keeping me on my toes. Any other questions before we sign off? I see a few people have signed off at the webinar, so I think we must be winding towards the end, but we'll stay on just in case anybody has any furthers. If you don't have any questions, don't feel like you need to stay on, but again, stay in touch. Good night, Kimberly. Thanks for joining. Got one last burning question. Feel free to put it in the chat. Thank you, Diana. Thank you, everybody, for joining. Thanks, Jacqueline. Thanks, Maisha. Thanks, Betsy. We look forward. Oh, to share the recording. Yeah, so we'll definitely share a recording link with you, and then you're welcome to share it with anyone. And we'll have it posted on our website as well. I should have said that. But yeah, share with anyone that may be interested. Thanks, Lori. Thanks, Roxana. Absolutely, Nancy. Happy to chat anytime.